I wanted to ask you, when you think back to the last year or so, since last Christmas, what has the last year been like? How would you sum it up?
Challenging, for in fairness for myself and for the government members, it's been a very challenging year. We've had to make decisions that, quite frankly, we didn't want to be making. We didn't want to face, some of the decisions that we had to, and I think that's fair of governments across the nation. That being said, I think it's been a challenging year for all Saskatchewan residents as well, as we've all changed, how we function in our everyday life, whether it be in our personal life, going to a restaurant, going to one of our kids' events, or how we operate in our professional lives, whether that be an office job or at a mine site. And so I think it's been a very challenging year for all Saskatchewan people, politicians included, and I think but we're in a pretty good place today. As we head into the Christmas season, we're in a much better place than we were 12 months ago. We're just delivering our very first vaccine in the middle of December last year. This year we have almost 2 million doses that have been taken by Saskatchewan people. Our active case count is the lowest west of Nova Scotia as we currently sit, and so we're going into this Christmas in a much stronger position than we were last year.
What lessons have you learned about your handling of the pandemic and some of the decisions you've made over the last few months here?
Well, the first thing I've learned is just how resilient Saskatchewan people are. We had to make some decisions this fall with respect to trying to push down some of the hospitalizations that we had, in particular the ICU patients that we had in our hospitals due to COVID-19. An inordinate number of those were unvaccinated individuals, and so we had to move with the masking policy, reenacting the masking policy, as well as a proof of vaccination, proof of negative test policy. And Saskatchewan people responded very well to that. And the proof is in where we are just a couple of short months after those policies were put in place. We've pushed our numbers down substantially, and our hospitalizations in turn have dropped as well. So what I've learned yet again is whether you're pulled over on the side of the road with a flat tire, or whether you're approaching a global pandemic as a Saskatchewan community, there's no one stronger or no one more that you want by your side than Saskatchewan people.
You've mentioned that the government should have moved a bit sooner on those measures. Is there a reason why it took longer than maybe now looking back you think it should have?
Yeah, I don't know. I said we should have moved a couple of weeks sooner with the public health measures that we did move on, and if we have a regret, that would be the regret that we have. There are other other things that I don't think are directly a regret of the government, but are somewhat regrettable, and that's some of the divisions that we see in not across society, but in small segments and smaller groups, across society, where there's a stigmatization or conversation around whether you're vaccinated, unvaccinated, and I see it in families, I see it in communities, and that's something that is just not the Saskatchewan way. We most certainly are an accepting community here in this province. We've shown that time and time again. We are always there to help out our neighbors, and I think we show that as much or more than any other area of the nation or any other area of the world. And I think we're into a time now where we had to make some decisions that were absolutely necessary. Specific to the proof of vaccination policy. We had to move on that. We had to push our vaccination rates up in order to keep our healthcare system operable and offering the services that we again are offering, thankfully, today. But that policy has proven to be quite divisive, and I think as a community, as a province, we need to move beyond looking inward at one another and start to look outward as to how are we going to provide the goods to the world as the world starts to rev its economic engine. That's when we do best. That's when we're most unified, is when we are looking outside of the borders of Saskatchewan, and how we're going to provide the goods that we do. How are we going to provide what Saskatchewan people can to the world? And that's where we're really looking to go in the new year.
When you think about making decisions related to the pandemic, and you mentioned, acting sooner during the fourth wave, we have a new variant coming out. Ontario expects it to be the take over Delta within, a day or two. What are you looking at right now as far as the new variant and how the government can respond to that quickly if in fact it presents itself as a danger to people here?
Well, what you're seeing is the responses that are already in place, the public health measures that we have, the masking, the proof of vaccination, proof of negative test policy that we have, the offensive strategy of providing rapid tests out to virtually households right across this province. And if there's a household that would like to have a rapid test, they can go to their municipal office, they can go to even a local service station now, a co-op service station, and pick up a rapid test. We want those to be on shelves in people's homes so that if they feel they need it, they can ultimately utilize that. The booster dose expansion that we provided some further expansion on a week or two ago, down to 50 years old, a 5-month interval, one of the more ambitious booster dose strategies in the nation, as well as ensuring that we are making vaccines available to that younger age group that has just become eligible as well, the 5 to 11-year-olds, and we're seeing, strong uptake in the early weeks of vaccines in that age group as well. And so, the most effective tool that we have in the battle against COVID, whether it be Delta variant, whether it be Omicron variant, whatever that variant may be, is vaccinations. 1, 2, and potentially a booster dose for some that are ultimately eligible. There are other tools that we have that help limit the spread, public health measures. There are other tools that we have available now and increasingly going to be more available in the future that will help keep people out of hospital, which is the goal. Some of the early intervention treatments that we have available now, monoclonal antibodies, we see Pfizer and possibly Merck that are working on an early intervention pill that would be available. And it's our job as a government to make all of these tools available to Saskatchewan people so that we can keep as many people protect as many people from contracting COVID, whether it be Delta, whether it be Omicron, and then ultimately keep as many people out of the hospital. And I think there's still some questions around not so much the transmissibility of Omicron. It seems to be fairly transmissible and will likely, overtake Delta wherever it becomes predominant, which I suspect will be most of North America at some point. But I think there's still some questions on whether it is as deadly as Delta or as virulent as Delta is. And so we'll see what happens with that as that variant starts to spread. But if it is spreading in Ontario, I think it's a matter of time before we can expect that it will be, spreading across Canada and across North America and likely around the world.
There are people that are 6 months from a shot that are under 50 that are hoping to get a booster. You have vaccines available. I know that clinics aren't, completely full right now. Are you considering lowering that even more and just making it the 5-6 months if there is this concern about Omicron?
Yeah. Well, one, NACI hasn't recommended that. I know a couple of provinces have moved, and we've had discussions as to whether or not Saskatchewan should move, and we may, and that would be a decision ultimately that we would act on the advice of our Chief Medical Health Officer, Dr. Shahab, and we may even move sooner rather than later on that. But there's also some other aspects that come into that decision making. Right now, we had held back about 10% of our staff that had been redeployed to operate our vaccination clinics through the public health system, alongside the pharmacies and others that are offering vaccinations as well, to ensure that we have the capacity to actually deliver to that 5 to 11 year age group, as well as the existing boosters that we have. So there's some operational capacity that goes alongside these decisions as well. But that's not to say that at some point Dr. Shahab may recommend that we lower that booster dose eligibility, and he may do that even prior to or without NACI's endorsement on lowering that below 50. We did tighten it up from 6 to 5 months to ensure that all of those over 50, which is our highest risk category, as well as those that are immunocompromised, do have eligibility for that booster shot, and in particularly have that eligibility before we see widespreads of the Omicron variant, for example.
I've been following and been covering your run as premier, and even before you were the premier. And I think that it would be safe to say that this year is probably the most criticism you've received, as leader, just given the impacts of the pandemic and the fourth wave. What's that been like for you personally?
I don't think anyone, likes criticism, but that being understood where we are, and where we are not just in Saskatchewan facing the COVID-19 pandemic, but where we are as our part of Canada and a part of North America and part of the world. I think that criticism has been occurring, with politicians far beyond Saskatchewan's borders, and it's coming from both sides. We hear, and I've said it often, that there's folks that think we've gone far too far as a government with the public health measures and the decisions that we've had to make, and then there's others that think we haven't gone near far enough. And so we do hear it from both sides, and I hear it in communities as well, amongst family members and amongst friends. And I said this earlier, this just simply isn't the Saskatchewan way. We're very busy right now, and for reasons that are evident as we face a global pandemic, but we're very inward looking in our province, and we're looking at our neighbors, and we're looking at one another, and at times we're even judging one another as to what their opinions are on COVID in whichever way. And I would just put forward that isn't when Saskatchewan people are at our best. We're at our best when we're actually looking outward together. Saskatchewan is a great exporting nation. We've exported people in years gone by. We export ideas and innovation, and we export natural resources. And where Saskatchewan people really unite and show their strength is where we are able to provide the world with, for example, food, fuel, and fertilizer, as well as, innovation around how those products are being produced. They're, being produced is more sustainably than most other areas of the world. And that is really where Saskatchewan people shine, is, our generosity at sharing not only the products that we have, but sharing the knowledge and the innovation that we have. And then ultimately supporting one another. I mean, there's nowhere in the world you'd rather be pulled over with some car trouble on the side of the road than this province right here. You're not going to wait there very long. Someone's going to stop and help you, and that's the Saskatchewan people I know. There is a very vocal minority on both sides of the COVID discussion. The vast majority of Saskatchewan people are still stopping, helping someone on the side of the road, and for that we're forever grateful.
Do you think this divisions that you're speaking of, and you spoke of last week, are a serious issue? Because as you've mentioned, the vast majority of people in Saskatchewan are vaccinated, and many are fully vaccinated that are eligible. So this wouldn't seem like there's a lot of people that are unvaccinated. Is this go further than that? Is this opinions on COVID? Is it opinions on the vaccine mandate? What do you mean when you hear about stories of divisions and families, things that they're referring to here?
Yeah, I think much of it comes back to the policies, and this isn't just in Saskatchewan, but the view of policies that are put in place that are essentially telling people how to live their lives, and we don't like putting in place or having discussions around putting in place a policy that is going to require a proof of vaccine or proof of negative test to visit a restaurant, for example. But it's absolutely necessary. It was necessary when we implemented it, and it's necessary yet today, as we quite likely are facing a new variant at some time in the days and weeks ahead in Saskatchewan. It is necessary for us to get to the not only the daily case counts that we're seeing through December here, but it's necessary for us to continue to keep our hospitalization counts down so that we can not have a number of programs and services and surgeries, quite frankly, that are being delayed or canceled in this province. So it is a necessary policy. We understand that there is some divisions of opinion around that policy. Those divisions don't always follow whether or not you're vaccinated. Those divisions, can quite often be, we just don't want to be told by the government what we should or shouldn't be doing, and I understand that. And I also judge no one on that. And I think it would do us all well in this province to just, as we approach the Christmas season, to ensure that we are, welcoming people, not allowing this COVID virus to get between family relationships, to get between friendships. The friendships and the people of this province are so much stronger than COVID-19, and I think you're going to see us prove that yet again as we enter this holiday season.
How does that affect decisions going forward? You know, if you're faced with having to put in, you know, a gathering limit or something in the future, even for a short span of time, how do those discussions and things you're hearing from the public affect, you know, what decision you make?
Well, they're part of the decision, any decision that any government makes, and they should be. I mean, ultimately, that's what a government is here to do, is to represent and to make decisions that are in the best interest of the public, but also are representative of what, you know, in our case, the people of Saskatchewan want as far as a direction for their province. And we live in a great democracy where if you get off course with the direction of the people of this province, every 4 years they have the opportunity to, you know, change who is the governing party in this province. And that's you know, that is the beauty of democracy in Saskatchewan, in Canada, and in the Western world. So, you know, as we look ahead, we're going to continue to do what we have done in the past. We're going to consult with our Chief Medical Health Officer. There will be an array of opinions around, you know, around any decisions that may or may not be made, as far as, you know, potentially if we have to be faced with increasing public health measures, or at some point if we feel that our vaccination levels have plateaued and the proof of vaccination policy has run its course and encouraged as many to get vaccinated as will. There may be a decision at some point that will have to be made around removing that policy, as it simply isn't increasing vaccination levels anymore. So those are, you know, decisions that are not in the near future, but possibly decisions that we'd be looking at if there should be an increase in the Omicron variant, for example, or if we find our way through winter and our numbers continually stay low. So we'll make those decisions as we as we find our way through time. In the meantime, what we are doing is, as individuals and as a government, encouraging other Saskatchewan people to do, and they are doing it, is learning to live with this virus in our lives and to make plans despite COVID being present in our everyday lives. And I think in a large part you're seeing people in this province do that. Yes, there's a few things that are different. We wear masks when we're inside. You might have to produce a negative test or a proof of vaccination at various events or restaurants that you are attending. But really, we're allowed to really go about our life largely in the same manner that we would have 2 years ago.
You mentioned elections and people being up to choose. I'm wondering if the last year or so has impacted your enjoyment of your job, or if you've thought about not running in 2024.
I have the best job in the world, and challenging, yes. But so many other occupations in this province have been challenging over the last course of time as well. But I do have the best job in the world. I work with great people. I serve the greatest people on earth, the people in this province. And, I have the opportunity. Yes, there's some challenging decisions that come with this, but I still have the opportunity as an MLA and as Premier to visit community after community and just see what amazing things people have done. And I show up when we're there celebrating often what is decades of service of an individual or a community group, and they built a new arena, or they built a new hall, or they built something or offered a service in that community. I show up for the celebration and to celebrate all of the effort of all of these folks that have just undergone what one would think is impossible when they embark on their journey. And greatest job in the world is the job that I currently have, and I'm just so honored to do it, and I still enjoy each and every day of it. Yes, the last year, 20 months have been challenging for myself and so many others, but I'm going to continue to do it as long as I have the support first of our caucus and the support of Saskatchewan people. And as I said, every 4 years they have the opportunity to cast their ballot.
I wanted to ask you about the changes that your government's proposing around security in this building and why you think that's needed, given some of the examples we've heard haven't been specific about threats to the building and security, but there have been some concerns that this is the government's attempt to clamp down on protests outside and that sort of thing. what can you say about the proposed security changes?
Yeah, no, not at all. This has nothing to do with clamping down on protests. It's about really ensuring, first of all, the functioning of government. Two, to ensure the security of all the folks that work or visit this building, and there's many staff that are in this building, as well as many people that visit this building on a daily basis virtually. And so what we are seeing with Bill 70 that is in the legislature is really being proactive as we look ahead, as opposed to being reactive and making some changes after there may be a significant incident or anything of that nature. Many of the protests that we see are out across the street here that aren't even in the precinct's jurisdiction, and so it has really nothing to do with protests that are being held here for whatever reason, and we see many throughout the course of a year, and this is the place for those protests to occur. So it has nothing to do with controlling or shutting down or changing how people are able to voice their concerns or their support at times with government direction. It's more about being proactive with respect to ensuring the continuity of governance in this building, ensuring the safety of the folks that work or visit this building, and really is similar to what we are doing in communities across this province through the speech from the throne and some of the commitments we made around some of the trafficking of people and guns and drugs, some of the added enforcement officers that we are putting, about 70 in total, across this province to ensure that we are keeping our communities as safe as we possibly can. Those are all, again, proactive measures that the Minister of Policing and Corrections has put in place.
Are you concerned that this will be seen as not independent with the way the bill's written, because currently the Speaker's office is responsible for security and the Sergeant at Arms, and this is a bit of a change from that, even different from other provinces that have been referenced by the Minister?
Slight differences, but minimal. And no, I'm not concerned at all. And here's why: is we have the RCMP ultimately report indirectly through the Minister of Policing and Corrections as well. We have 350 provincial law enforcement officers. We have highway traffic officers. We have conservation officers. We have provincial enforcement officials in the park here in Regina that all report directly to the Minister of Policing and Corrections. The sheriffs that keep our courtrooms and our justice system safe also report directly to the Minister of Corrections and Policing. None of those are in any way I don't have any concerns with respect to how all of those, each of them professionals in their own right, conduct themselves and enforce the laws in the province of Saskatchewan. And I have, absolutely zero concerns with respect to, how that might transition in this building.
I wanted to ask you about the government's, response or interactions with doctors in the province. There have been some cases outspoken critics of the government's pandemic response and sent letters. I know the medical health officers have expressed concerns about the government's actions. And as you look to 2022 and what we talked about the variant, how do you look to repair some of those relationships? Do you work more directly with some of those doctors? Do you think that the system as it works now is sufficient? It's just the nature of the pandemic. How would you characterize how that relationship has unfolded over the last year or so?
I think the relationship is fine. I talked to many physicians, including some that are chief medical health officers that have penned various letters to the government, providing their insight and really their advice and the advice that we ultimately take at the end of the day, and we've been very clear on this, is from our chief medical health officer and Dr. Schaub and the consultations that he has with the Saskatchewan Health Authority, the Ministry of Health, and ultimately the Minister of Health. And the regional medical health officers, work very closely with individuals and groups and organizations within their region on ensuring that they are communicating where the provincial for example, what the provincial public health orders are, how they ultimately impact whatever the event or the organization is, attempting to, usually bringing people together, and they do very good work with respect to, communicating on that regional basis how the provincial public health orders or provincial recommendations may or may not impact what is happening, as well as they work closely with local organizations, schools, and others on, what the isolation protocol is when there's contacts made, what the, the vaccination protocols and what the vaccination opportunities are for booster shots, for example, it being at 5 months and as opposed to 6 months, and those types of things. And so we appreciate all of that work that our regional medical health officers do at that regional basis. I've also taken the opportunity to talk to a number of other medical health professionals, physicians, nurse practitioners, as well as nurses that I've had the opportunity to talk with across the province. There's some varying opinions, admittedly, on all things COVID, like there are varying opinions out in the public as well. And so I think we have when we talk about, the challenges maybe of my job or other folks in this province, nowhere have those challenges been larger than the folks that are working in our healthcare system. And as we look ahead at how we are going to function in that system, is what we have today as far as capacity of people, ICU beds, surgery capacity, is that all in the right place as we look to where we need to be in the weeks and months ahead? And I think it's fair to say that there's going to have to be some significant increases in all of the above when it comes to looking at our healthcare system into the future. And this is one of the reasons why we are seeing all premiers realize just that, and all premiers united in their ask for the federal government to be a full funding partner through the Canada Health Transfer, of which they have slipped over multiple governments in multiple decades.
My last question is related to looking into the future, and are there certain things in 2022 that you're looking to accomplish, things that you're hopeful about?
Yeah, I am extremely optimistic and hopeful for the province of Saskatchewan as we look ahead to 2022. And yes, we have to continue to be vigilant with COVID-19. We're hearing of a new variant that will be likely approaching our communities in the weeks ahead, and so we have to be very vigilant with what we're doing each and every day, and the public health measures that we have in place are absolutely necessary as we approach yet another unknown in our 20-some months of approaching COVID. But I am very hopeful and very optimistic for the province of Saskatchewan. As you know, we were able to attract a little over $10 billion in investment over the course of this past summer in multiple industries. We see a new potash mine, the largest potash mine ever being built by BHP out at Jansen. We see 4 significant investments in canola crush facilities. We see strong activity in the uranium industry, in the helium industry, the energy industry. The oil industry is back up to a strong and sustainable level with its pricing. We had a challenging drought this year, but farmers, thanks to their resilience and innovation, I think we're going to see good times ahead in the agriculture industry. And so when I look at what we've been able to attract as far as investment and jobs and opportunity in the last year, I think we're just setting pace, and I think we have great days ahead of us as we continue to attract that investment, ultimately provide those jobs for, yes, people to move here, but provide that opportunity for that next generation, my kids, your kids, others, to actually stay here, to choose a career in the community and most certainly in the province that raised them. And we haven't always had that opportunity in Saskatchewan, and I think we are going to have it in as large a proportion as we ever have when we look ahead to the next couple of years. And that is what I will be reflecting on as I spend some time with my family through this Christmas season.
Thanks, Premier.
Hey, thank you so much, Adam.